Hi, I'm Douglas DiRuggiero. I'm a physician assistant that practices in Georgia, and I have the great honor of being here with a colleague and close friend, Leigh Ann Pansch. Leigh Ann, why don't you introduce yourself?
Love to. Hi, I'm Leigh Ann Pansch. I'm a nurse practitioner and I practice in the Cincinnati area for DOCS Dermatology.
Leigh Ann, what I want to ask you about is vitiligo. It's something that we all see in our clinics. And until recent years, we really had nothing to offer our patients outside of what dermatologists were offering patients 50 years ago. Cover it up, maybe some steroids, maybe off-label use of tacrolimus, and this has such a heavy impact at no matter what age it's there. So let's talk about just what we have available, and then I want to dive in real quickly on what we do when people are seeing response to the newest therapies for this.
Yeah, absolutely. We all see vitiligo in our daily practices. It's something certainly that's common to be in our offices. And so it is incredibly exciting that we can talk about peripheral or marginal and perifollicular repigmentation and to track it over time in real time with our patients. And of course, we are the visual specialty, so we're imaging this all along the way. And even at follow-up visits, one of the favorite things to do is to sort of pull up that picture from pre-treatment and then show them today, side-by-side comparisons, and really to help them to see the impact. Because it's hard when you're looking at yourself on a daily basis in a mirror. You might not see it, but you see that pre-picture and that post-picture. And it is incredibly exciting to see the joy on patients' faces because it's such a slow process.
So we have topical ruxolitinib approved for this. And this therapy is what's creating those changes that you're talking about. And I think it is something where we have to continue to give patients hope and cheerlead them because it's a slow process. Even though we have an FDA-approved therapy, it's a therapy where I think you need to really set expectations on what the process is going to be, the timeline that's involved. But it is nice to show those photos. So let me ask you to dive in on that. Say we have a patient who's doing phenomenally well. They've been on topical ruxolitinib, per its label, per its indication, and they're seeing repigmentation. In fact, even some patients complete repigmentation. And they come to you saying, it looks great. I'm so happy. I know that, but I really would prefer to see how I do coming off of this. Is there data, I don't know if we call it remittive data, but is there data that shows what happens to those who achieve repigmentation success and then stop therapy? Can we advocate that? Can we encourage that? Should we not? Why don't you address that for us?
It's such a great question. And when I get asked this question in clinic, which is very, very common, I really like to equate it to something like diabetes. Just because I think people hear diabetes and they recognize that if you have diabetes and you're on insulin, you're going to be a lifelong user. And it's really not a horrific thing. It's part of the maintenance that we need for our bodies as a whole. And so when you talk about chronic skin disease, it really is extremely important that we help our patients contextualize the chronicity of their illness first and foremost. And, unfortunately, in my own practice, some patients will show up to my office having sort of been lost to follow-up. And they come back and they have lost some of their pigmentation again. They've depigmented. Some of them have new areas of depigmentation, and they know that they need to come see me. And that's what they say. I'm so sorry. I should have come back in. And so exciting, to kind of follow this through with them and just to remind and really be their cheerleader. That, learning how to ride a bike, it doesn't happen the first time you get on a bike. It doesn't happen the second time. It really does take time when you talk about a routine, but certainly putting a cream on our white patches morning and night is something that we can all work and strive for. We know that really is where the best data is. And I will tell you in my own clinical practice, when I have a patient that's doing really, really well, I really like their disease to be in good control for at least 6 to 12 months. And once I've gotten them to a place of complete control, no new areas, no depigmentation, no concern for loss of efficacy on topical Rux cream BID, I'm going to sort of play around with that application at that point, because I really feel like, again, this is not a cure because we're treating it. It is a treatment effect. And so I'm going to tell that patient, if I have a patient who's really pushing, that I'd like them to go to, maybe an every other day application of twice a day. Let's skip some days. Let's give you some days without. And I'm going to see them more in that period of time. We're going to use serial imaging to sort of follow this and track this over time. And I have some patients that are successfully able to get down to maybe 3 days a week. That's about the lowest I've gotten.
Okay.
And then the trigger to sort of restart on twice a day would be a new area or loss of depigmentation. Again, that's sort of how I manage it in my clinic.
And I think that's how all of us are managing it. Unfortunately, we don't have a protocol or a consensus or an FDA approved protocol on what to do. So it really is something. I think the key message I'm hearing from you, and I've seen this as well, is that when patients are lost to follow-up or they lose their insurance and can't pay for it and can't get the cream, we see those patients begin to depigment. So that experience allows me to tell a patient who does have access to the cream and is keeping their appointments, but is just inquiring, I can say to them, look, others I've seen stop the cream for whatever reason, insurance, moving away, they start to lose their pigment again. I don't want to see that happen for you. So if they're solid, I do the same way. We begin to modify. But the important thing for our listeners is that there is no FDA approved or company approved protocol on how to handle this, nor I don't know of any data that shows what percentage of people will recapture their pigment if they stop and depigment. That's another great study question that we just don't have a good answer to. So the key is, if it's working and you can get access to it, stick with it.
Absolutely.
And stay on it. And then just talk to your prescriber, your provider, if you're a patient, about maybe creative ways of using it a little less frequently, but that has to be done, I think, in real close consultation with the person who's prescribing it, and realize that's an off-label use as well, but still.
Absolutely.
Well, thanks for being here with us and for sharing your expertise and your clinical knowledge. It's helpful to all of us. Thank you very much.
Thank you.